This is Dr. Caroline Peterson. I'm a chiropractic physician, retired midwife, and researcher. I'm talking to you about common complaints of pregnancy, and today we're going to talk about edema. Edema is something that not everyone experiences in pregnancy, but when people experience it, it can be very uncomfortable. And there's different kinds of edema. The most severe form of anemia that people can experience will include the face and the hands, and that is preeclampsia, and so that's a very severe type of edema that your OB and midwife will have to handle. If it's something less severe than that, let's say if it's in the ankles or maybe you can't wear your ring anymore or something like that, then these types of tips are intended for that. Edema basically means that fluid is not in the right place in your body. And we keep fluid in the right place by having enough protein and having enough electrolytes in our body. So if you have edema in one leg but not the other leg, that's also something else. That's mechanical, right? So if you don't have the right kind of electrolytes and proteins, that's going to be over your whole entire body. But if you would just have one leg that's affected by edema, that is more like a mechanical problem. So that could mean that one of your organs is blocking the return of the blood or the lymphatic fluid, and that's causing the puffiness. If you have edema equally on both sides of your body, then that's suggesting that you need more protein, and often in midwifery we'll suggest that women get up to 90 grams of protein a day. And for many women, especially vegetarians, this is very, very hard to do. So you really have to keep track of that. Look up the grams of protein per serving of different kinds of foods online and keep track of that until you get that increased. The other thing is to take electrolytes. So electrolytes are found in things like bone broth, coconut water, the peels of vegetables and fruits. And basically fresh fruits and vegetables are a great source of electrolytes. The other thing that's really helpful is magnesium, and for muscles especially, magnesium malate is important, and so that can be one that's helpful for decreasing the edema. The other thing that can be associated with edema is insufficient choline in the body. Choline is something that we use to make cell membranes. And so because you're making a whole entire new person, you are making a lot of cells. And there are some genetic SNPs or mutations that make it hard for a body to make or use choline. And so bringing on board extra choline is important. Most choline in the United States is made out of soy. So if you have a sensitivity to soy, then look for the kind of choline that is made out of sunflower. That's a little bit more expensive, but that won't target your immune system in the same way. And then as far as the dosing, you'll just bring up the dose until the edema diminishes.